Hi everyone, welcome back to CBT class. Today we'll focus on mindfulness and CBT. Basic premise in integrating mindfulness into CBT. From CBT advocates' perspective is that mindfulness can be effective in reducing distress and helping clients disengage from unhelpful rumination. But when there's an underlying cognitions that are persistent and intensive, mindfulness techniques alone cannot help with the client's improvement, and some cognitive restructuring would be necessary. Those who are deeply into mindfulness living and regularly exercise mindfulness may have different perspectives as they see mindfulness as a way of living, and then really helping clients to change their relationship with thoughts rather than trying to focus on evaluating and changing the content of their thoughts. So in today's class, I will start with briefly introducing what mindfulness is, and also expose you to several mindfulness-based interventions so that you can learn how some of these interventions might help you overcome some limitations with traditional CBT, particularly those with suicidal thoughts, emotional dysregulation, some personality traits, and also trauma history. Um, uh, since today's topic is on mindfulness, I would like to start this lecture by inviting all of you to engage in this mindful meditation exercise. You don't have to do this if you don't feel comfortable, but if you're okay, just play the video, go along with that. And before you do that, you can read what's written, this quote to your right on the side about mindful breathing as the best practice. So while you're watching the video, just keep breathing in and out and just enjoy the moment as you do this exercise.
Sitting comfortably, letting go of the outer world. I give myself space to let go of all tensions and worries. I cast away all expectations and blocked energy that's been accumulated. Letting go of the push and pull of all the thoughts and feelings. The heaviness that I've been holding on to begins to dissipate. It feels so good to let go. Like a bird letting go of the branch, I become lighter and lighter. Soaring higher and higher into the sky. I enjoy the freedom. Feeling light and infused with quiet joy. When I'm ready, I gently slow down and come back to my inner world. With optimism impressed on the surface of my mind, I allow the feeling of light to spread from my mind sitting comfortably, letting go of the outer world. I give myself space to let go of all tensions and worries. I cast away all expectations and blocked energy that's been accumulated. Letting go of the push and pull of all the thoughts and feelings. The heaviness that I've been holding on to begins to dissipate. It feels so good to let go. Like a bird letting go of the branch, I become lighter and lighter. Soaring higher and higher into the sky. I enjoy the freedom. Feeling light and infused with quiet joy. When I'm ready, I gently slow down and come back to my inner world. With optimism impressed on the surface of my mind, I allow the feeling of light to spread from my mind into the body and into the room.
Hopefully you feel more mindful, refreshed, and ready to focus on lecture after the breathing exercise. So what does it mean to be mindful? Um, Dr. John Kabat-Zinn defined mindfulness as paying attention in a particular way on purpose in the present moment and non-judgmentally. He's a well-known, famous professor emeritus at the University of Massachusetts School of Medicine. He's also developer of MBSR, Mindfulness-Based Stress Reduction Program, which has been implemented internationally. Is a well-known author and scholar around the topic of mindfulness, so it's a good person for you to know. Read this paragraph on the slide to better understand what it really means to be mindful and how you can tell whether you're mindful or not. And you can use this to kind of explain the concept of mindfulness when you engage your clients in mindfulness-based exercises for the first time. So why mindfulness? Mindfulness has become such a hot topic. Everybody's talking about mindfulness, um, especially in the field of mental health, but also in physical health area as well. I want you to watch this video to have a better understanding of why it has become such a hot topic and what's the vision for mindfulness in our time.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, you're driving down the road and somebody cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you, rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, who's chasing you? But then what happened next? The scientists swooped in, they showed that physical exercise is really good for you, and now all of us do it, and if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribed for you. Let me just close by saying, mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower, and one that is accessible by you immediately.
So in the video, it talked about the importance of being able to respond wisely to daily situations that we face without really reacting to those situations recklessly. And mindfulness make it possible for us to do that, and therefore mindfulness is superpower. So in therapy world, that's called wise mind. When we were learning about CBT, we mainly focused on feelings and thoughts. Your emotional mind is driven by your feelings without reasoning or logical thinking. Decision making is driven by your emotions, in which case you're mostly reacting to your feelings. Your rational mind approaches knowledge intellectually based on facts and science. Mindfulness-based approach suggests that the wise mind that sits in the middle, synthesizes and balances the information coming from both of your emotional and rational minds so that you can live mindfully moment by moment every day. Those concepts such as wise mind and mindfulness has been recognized as central to the process of working with borderline personality disorders or people with, in general, have problems with emotional regulation. Most people with BPD has problems with regulating emotions and thoughts, problems with impulsive, reckless behavior, and having very unstable relationship with other people. And not only that, people with BPD have high rates of co-occurring disorders such as depression, anxiety, substance abuse, eating disorders, self-harm, and suicidal behaviors or completed suicides. So a lot of people that you will meet in your agency, although they may have primary diagnosis of depression, anxiety, you will see a lot of clients having issues with emotional regulation and self-harm behaviors. Dr. Linian, who developed DBT, dialectical behavior therapy, explains emotional dysregulation based on biosocial theory. So this theory suggests that emotional dysregulation is caused by the combination of biological and social factors. The biological factors include a person's biochemical compositions, as well as physiological and psychological preparedness to act in certain ways in response to environmental stimuli. So this is called action tendencies. So a person can be born with action tendencies that are characterized by emotional vulnerabilities because of these biological factors. When this type of person grows up in a socially invalidating environment where their displays of action tendencies and following emotional reactions are ignored, dismissed, or punished. When this person grows up in this socially invalidating environment, this person develops problems with the ability to understand and label feelings, coping with difficult emotions, and regulating feelings in general. As a result, this person develops maladaptive coping skills to cope with those very painful feelings that they really don't understand what's going on. So those maladaptive coping skills can include self-harming behaviors like suicidal behaviors or making threats of suicidal attempt repeatedly. Dr. Linian realized that it's extremely difficult to treat this type of clients through traditional cognitive or behavioral interventions because, as you have learned, cognitive behavioral therapy tends to be problem-focused. So when therapists try to identify clients' problematic thinking or behaviors, that actually served as triggers for many of these clients because of their history of growing up in an invalidating environment. So these clients felt that therapists didn't really understand the depth of suffering that they were having, and their therapists were overestimating their ability to help with the client's issues. So as you can imagine, it really significantly interfered with therapists developing alliance with clients, and clients dropped out of treatment prematurely a lot of times. So Dr. Linian developed DBT and then added the central component of radical acceptance of client issues. So that helped the clients feel that they were better understood by the client, by the therapist, and was able to stay longer in treatment, and therefore their symptoms improved faster. So DBT still maintains the ideology of CBT, but therapists are trained to radically accept the problems that clients are having, while also helping clients to radically commit to making changes to better their lives. So let's hear directly from Dr. Linian about her experience of developing DBT.
I started working with highly suicidal people. As it turned out, the people met criteria for borderline personality disorder, but A, I had never heard of borderline personality disorder, and B, I didn't know what it was. Even if you told me the name, I wouldn't have known. So that was the beginning of the whole thing. I had no idea what I was doing, except that I was studying suicide. What happened was standard behavior therapy of the 1970s and early 1980 blew up. And the main reason it did is because what it requires for it to work is for a person to come in and you be able to say, okay, here's the problem and here's what we'll do to change it. And for the person to say, okay, I'll try that. But the people I was dealing with immediately said, you're saying I'm the problem. And so they were so sensitive to any invalidation or statement that they were the problem that the treatment blew up. And they would either get angry at me, hide behind a chair, storm out, quit therapy, yell and scream, cry, or say they're going to kill themselves. So it didn't take me too long to figure out this was not going to work out. So I thought, okay, we're going to switch to a more acceptance-based treatment. So I'm going to validate and be very accepting. So I tried that. That blew up also, because then the patient said, you mean you're not going to help me? You're just going to listen to me? Most of the patients I treat have already been through a whole lot of therapy where you talk, get listened to, and understood. The problem is talking, being listened to, and being understood doesn't necessarily make anything change. So then they got really upset with me because I wasn't helping them change. So that's when I realized that I had to pull together a major emphasis on change with a technology of acceptance. So I had a technology of change, now I needed a technology of acceptance. The technology of acceptance primarily was validation. So it's behavior therapy with a huge amount of validation. So problem solving, validation are the core components of the treatment.
So the term dialectics come from Eastern philosophies and religious beliefs. The literal meaning of dialectic is weighing and integrating contradictory facts or ideas with a view to resolving apparent contradictions. Some of you might have heard the term yin and yang, which means darkness and light in Chinese. It represents a concept of dualism, that two opposite forces that seem to be contradictory to each other are actually complementary, interconnected, and interdependent. In DBT, the two central processes that seem to be contradictory to each other, which are radically accepting clients' issues while radically committing to making positive changes, these two central processes are integrated into the treatment processes. There are 4 core skills that are taught in DBT, which includes mindfulness skill, distress tolerance, interpersonal effectiveness, and emotional regulation. And I'm not going to go into the details addressing each of these skills, but I posted a website. It's a DBT self-help website that was put together by people who've been treated through DBT previously, and you can find a lot of good information there. And then there are like handouts summarizing each of these core skills. So you'll find this website helpful. So again, the purpose of this class is not to really teach you all the skills, but to expose you to different modalities that's out there so that you will know where to go to find more information. MBCT, mindfulness-based cognitive therapy, is another CBT-based intervention that actively incorporates mindfulness component. MBCT is a manualized 8-week group sessions that combines mindfulness with some cognitive therapy techniques. So the intervention involves various meditation and mindfulness exercises, as well as other components commonly found in traditional CBT, such as psychoeducation, behavioral strategies, and homework. Although MBCT incorporates some elements of CBT, in nature, it is very different from traditional CBT in that MBCT focuses more on changing the ways one is relating to their thoughts and feelings rather than the content of their thoughts. In other words, MBCT doesn't emphasize identifying and modifying distorted thoughts as how it's done in CBT. But focuses on increasing one's metacognitive awareness, which is defined as the degree to which thoughts, feelings, or beliefs are experienced as mental events rather than as aspects of self or direct reflection of truth. What this means is that, for example, in CBT, once you identify the distorted thought, I will never be successful, you try to change the thought into more realistic and healthier thoughts, such as I may fail in certain things, but I can be successful in other areas. Instead, in MBCT, when you catch those thoughts in the moment, you just simply acknowledge the fact that you're having those thoughts. So acknowledge that I'm having these thoughts, but reminding yourself that thoughts are just thoughts. They're not reflection of the absolute reality, thereby reducing the intensity of the impact those thoughts have on your mental and physical status. So the table on this slide summarizes some of the core differences between these two approaches. One other important difference that I would point out is that the role of a therapist in CBT can be seen as the one who instructs and coaches, but in MBCT, therapists help the client to develop mindfulness by embodying the approach themselves. And because of that, mindfulness-based interventions, including MBCT and other interventions that we talked about today, all those mindfulness-based interventions require therapists regularly engage in exercises and also the way of living that actively promotes mindfulness for themselves. You see on this slide the book Mindfulness-Based Cognitive Therapy for Anxious Children. This is a book that I've been using frequently when working with children with anxiety symptoms. I mean, it's basically written for kids with anxiety, but a lot of activities, skills that are included in the book can also be used for children with other issues. I find this book really helpful. It's got manual, it's got a lot of handouts that you can print out. So for those who are interested in MBCT approaches for children, can look up this book online. When we were talking about DBT, dialectical behavioral therapy, we talked about the concept of the dialectics, radical acceptance of who you are in the current moment, while committing to make positive changes at the same time. Acceptance and commitment therapy, which is also called ACT, is another mindfulness-based intervention that incorporates that concept, the concept of acceptance in committing to change. So its underlying philosophy is that symptom reduction is not the goal of therapy, because when you keep trying to get rid of your symptoms, for example, if you have a panic disorder and you're suffering so much because of that, you keep trying to get rid of it. Like you keep trying to avoid having panic attack, and that relentless pursuit to get rid of that panic attack creates a clinical disorder in the first place. You worry about panic disorder. You keep thinking about how to get rid of it. And because it becomes the major topic of your thinking all the time, the minute you start thinking about it, you become anxious. So, so the goal of acceptance and commitment therapy is not symptom reduction. Rather, it focuses on creating a rich, meaningful life by transforming our relationship with difficult thoughts and feelings, so that we no longer perceive them as symptoms. So as you just commit yourself, like, radically accept who you are right now, and committing yourself to a life that's meaningful to you based on your own personal value system. As you actively pursue that kind of life, your focus becomes not the disorder itself, but your focus becomes your life itself. And by living that kind of life, symptom reduction becomes a byproduct of living this kind of life successfully. Watch this video to directly hear from the developer of the ACT. Why acceptance? Why commitment? Stephen Hayes, the developer, has some interesting life history. He is a well-known professor, a very smart person dealing with panic disorders. He had a lot of issues having panic attack while having important meetings with the professionals and things like that. So developing ACT was really part of his own struggle to find solutions to the problems that he was having.
Well, the advice I'd give, and if you were my patient, it'd be a little different because we'd have a little more time. But if I can distill it down to the essence of what we do in a course of therapy, the person with panic, I can say this from the inside out since you're looking at a panic disordered person in recovery, has adopted a posture with regard to the world within in which their own anxiety is their enemy. And they think that if they can just get the anxiety to go down, go away, not occur as much or not occur with such intensity, or at least not occur here or there in that situation, that then things would be better. In fact, all of that is not the solution to the problem, it is the problem. Holding anxiety as your own enemy, and that it has to go down, diminish it, go away, and not happen here, is a kind of self-invalidating, interiorly focused process that would get you even more entangled with these processes. Instead, what we're going to need to learn to do is to allow your history to bring into the present thoughts and feelings and memories, and to sort of hold them mindfully and self-compassionately, and then focus on what you do and bring them along for that journey. So, feelings are only your history being occasioned by the present moment. If that's your enemy, then your history is your enemy. If sensations are your enemy, your body's your enemy. If memory is your enemy, you better have a way of controlling your mind in such a way that you never are reminded of things that are painful from the past. Well, there is no such thing like that that's healthy. And most of the things that people do that are called psychopathology are the unhealthy things people do when they try to accomplish that agenda. If you avoid people, avoid having your buttons pushed, avoid going to places that might occasion anxiety, if you're hammering down drugs and alcohol, these are all methods of trying to mount that unhealthy agenda. So I would say, could we instead take this anxiety to be something that may be of importance, may even be meaningful, and it says something about your history, and could we learn to sort of hold it in a way that's more compassionate, to sort of bring the frightened part of you close and treat it with some dignity, and keep focused instead of making that go away, focused instead on what kind of life you want to live connected to what kind of meaning and purpose. That's going to be a quicker, more self-compassionate and more certain journey forward than this kind of out with the anxiety, in with the relaxation, out with the self-doubt, in with the confidence kind of let's just snap out of it kind of harsh and lack of a non-compassionate place that we stand with ourselves inside things like panic disorder.
So the two main processes in ACT is, first of all, developing acceptance of unwanted private experiences which are out of personal control. And secondly, committing and making actions toward living a valued life. There are 6 core principles of ACT, which includes total acceptance, as we talked about previously, including all the issues and problems that we're dealing with. And also a focus on present moment, which is a definition of mindfulness. And also pursuing life of personal value and committing to take actions that can lead to living a life of personal value. And discovering self as context, which is the observing self, a part of yourself that does all the noticing, observing, being completely aware of your inner and outer world, the kind of wise mind as we talked about before. Lastly, cognitive diffusion is distancing yourself from the thoughts and emotions that you're having, so that those thoughts and feelings have less impact on you and less power over you. So all these core principles are expected to work together to ultimately increase your psychological flexibility, so that your relationship with the thoughts are changed. So there's no effort to get rid of thoughts or changing thoughts, just having the awareness that thoughts are just thoughts, and only you can allow those thoughts to have an impact on you. So far, you learned about various mindfulness-based mental health interventions, and by now you might understand how they are different from traditional CBT. Beck Institute and Dr. Beck have a specific way of approaching mindfulness based on the idea that cognitive restructuring is useful when thoughts are distorted, especially earlier in treatment. Mindfulness can be useful when clients are engaged in cognitive processes such as worry, rumination, and thought suppression. So Dr. Beck suggests 3 specific ways of incorporating mindfulness into CBT. First one is mindfulness of thoughts, which is trying to disengage from worry, rumination, and thought suppression. And secondly, mindfulness of sensation and emotions, which is to accepting uncomfortable sensations, emotions, and mindfulness of attention control, which is shifting focus to the physical properties of object in the external environment. In this video, a faculty member and a psychologist at Beck Institute, Robert Hindman, will briefly explain the process of mindfulness exercise within CBT and take you through the processes so that you can experience it yourself. Please follow his guidance to complete this exercise and think about how you might facilitate this exercise with your client.
Hi, my name is Rob Hindman, and I'm a clinical psychologist at the Beck Institute. We're a nonprofit organization with a mission of improving lives worldwide through cognitive behavior therapy, also known as CBT, and we do it through a combination of training therapists in CBT, as well as conducting it ourselves with clients who come to our clinic. And one of the things we've been seeing a lot of lately, which you might expect, is clients very anxious about the current COVID-19 pandemic. When clients have been coming in, a big way they've been coping is with worry, and we consider worry a coping strategy, not necessarily a helpful coping strategy, because it's something a lot of us do when there's any bit of uncertainty. So when you don't know for sure what's going to happen, when things kind of seem, up in the air, we cope by thinking through all of the potential bad things that can happen. But with worry, you never really come to a solution. And when you think through it, you're not actually doing anything. So the reason why people worry in the first place is we have beliefs about worry, mainly that it's helpful in some way. So we might believe that if I think through all of these potential catastrophic scenarios, I'm going to come up with an answer, and I'm going to either feel better, I'm going to be prepared, or it's going to prevent any kind of dangerous thing from happening. But again, when we're just thinking through it, we're not taking action and nothing is actually happening. All that's happening is we're stoking our anxiety because our body has no idea if what we're thinking is actually in front of us right here, right now, or if it's just a thought. So even when you're just thinking about these terrible things happening, your body's going to respond with anxiety because anxiety is just energy for a challenge. So one tip I've been teaching my clients is something called mindfulness. And mindfulness is just when you're aware of what's going on in the here or now, in the present moment, and you're aware of it in a non-judgmental and accepting manner. So what happens is a client might read the latest news about the COVID-19 pandemic, then they start thinking about how this is going to affect them, how it's going to affect their lives. That leads to a lot of anxiety, but you can choose whether or not you want to keep on worrying or whether you want to shift focus to something else that's not as threatening. So I figured we could do a mindfulness exercise now. A lot of people learn mindfulness through yoga where it's a lot of focusing on the breath. So I figured I'd do something a little bit different where it's focusing on something visually in front of you. Because you're watching the video, what I'm gonna do is I'm just gonna scoot out of the way and I can just have you focus on what's behind me in my office since there are a bunch of different objects. Before we get into this, I'm gonna want you to start worrying though. So I'm gonna instruct you to get worry going because that's gonna help us test out some beliefs about worry as well. So I'm gonna scoot to the side here. And what I want you to do is, I want you to have your eyes on what you're seeing in my office, but I want your real focus to be on worrying. So kind of like what happened day to day where you're doing something, but you notice you're really in your head worrying. So while your eyes are on what's in my office, I want you really to be focused on worrying, particularly about what's happening in the world right now. So get this going for a little bit. Now I want you to take note of how anxious you feel. 0 to 10, kind of rating it. 0, not at all. 10, the most anxious you can ever feel, the most anxious you've ever felt in your life. Now what I want you to do is I want you to shift your attention just to what's in front of you, what you're looking at right now. So notice the different objects in my office. Focus on the colors, the shapes. Maybe noticing how the light shines against some of them. Just putting your full attention on what you're seeing in front of you. As you do this, you'll notice that your mind's going to be doing a lot of different things. A lot of different thoughts are going to be showing up. And every time you find yourself getting caught up in thoughts, just notice that's happened and then gently bring that focus back to what you're seeing in front of you in my office. You don't have to try to force any thoughts away or try not to think about anything. So as you're focusing on what you're seeing in front of you, you'll notice different thoughts in the back of your mind. All you have to do is just let them stay in the back of your mind where your main focus is on what you're seeing, letting those thoughts just kind of come and go on their own without trying to interfere with them at all. And there's no need to criticize yourself for having your mind wander or getting caught up in thoughts, because that's just normal experience. Just kind of take note when it happens, every time it happens, and then just gently move that focus back to what you're seeing in front of you. So I want you to take another mental note of how intense your anxiety is now, and we can end the exercise. So, what kind of things did you notice doing that? So first, what happened to anxiety? So what typically happens to anxiety is that it goes down, and the point of the exercise isn't to force anxiety down or to try to eliminate it. Anxiety is just going to be proportionate to what you're focusing on. So when you're focusing on all of these catastrophes, you're going to feel anxious because your body's responding to it. When you focus to what's going on right here, right now, so like my office, as long as it's not something threatening, anxiety is going to naturally fade because it's not needed anymore. Another thing to take note of is if you were able to actually do that, to notice that worry to begin with and then let go of it. Because another belief about worry that keeps it going is the belief it's uncontrollable. Now, we can't control thoughts showing up in our minds, but what we can control is how we respond to them. So every time you find yourself getting caught up in worry thoughts about the current pandemic, what you can do is just notice they've happened, and then instead of thinking more into them, just refocus back on whatever's in front of you. So if you're in your house watching Netflix, which is a common thing right now, just go back to watching whatever's on TV. If you're with family, having a conversation, you might notice attention go in your head. Just kind of notice that's happened, and then you have the ability just to bring that focus back to what's in front of you by just visually noticing what's happening. So I hope this was a nice quick tip that was helpful that you can put into action. So every time you notice your mind kind of in this worry process, you have the ability to kind of redirect back to what's going on in the right here, right now, as a way to get out of this worry. So I hope this was helpful, and take care.
To summarize what you went through with Dr. Hyman in the video, first of all, you purposely induce thoughts. Oftentimes it's negative thoughts like worries, and then you rate the intensity of the negative emotions. And then you engage clients in these mindfulness exercises. And after that, you re-rate the intensity of the emotions again. And as you do after facilitating any kind of CBT interventions, you elicit feedback, and also using guided discovery, help your clients to think about the lessons they learn and how they might apply that into the situation where they are bothered by rumination and worries again. And then you assign an action plan so that your clients can exercise these interventions outside of therapy. When you assign mindfulness-based interventions as action plans, you can mention that these exercises can be both formal and informal. So if you are doing the formal exercises, you will set aside a period of time, go to a quiet place, and then focus your attention on a particular experience. So it could be your breathing or sensations on different body parts, your movement, or you can choose to just focus on your thoughts and emotions, not to really analyze them, but to just notice that you're having these thoughts and then you're having these feelings, or find an external objects or sounds that you can focus your attention. If you do it informally, you can just encourage your clients to try to focus on whatever they're doing every day, like throughout their entire day. I try to be more conscious about what's happening in the moment in daily activities. So there could be mindful driving, mindful eating, because a lot of times when we are doing these like everyday kind of activities, you oftentimes don't really focus on what you're doing, but instead your mind is filled with worries and ruminations or other thoughts that are not really relevant to what's happening right now. So that really takes away your ability to live a moment by moment life, really focusing on what's happening here and now. There are certain type of clients who may not really benefit from mindfulness exercise. For example, clients with poor emotional regulation skills, clients who tend to be highly perfectionistic and self-critical. The reason why this type of clients would not benefit a lot from mindfulness-based intervention is that sometimes they will, focus too much on being present in the moment. Whenever their attention is drifted away, they kind of feel that they failed, and then they start criticizing them again. So you probably need to do some more, other types of interventions to really bring, the awareness, attention to this kind of traits, and then how that might affect your client's perception. That might actually need to be done before you start utilizing mindfulness techniques. And clients who dislike previous mindfulness experience, as I mentioned previously, a lot of mindfulness-based interventions are actually rooted in Eastern religion. Those were particularly affiliated with certain kind of religion, have some assumptions about this kind of exercises, might not benefit from the exercise because the perceptions would be shaped by their previous bias or assumptions. So today you've learned some basic concept of mindfulness, and you've been also exposed to several interventions that has mindfulness component as central treatment components. So you can think about some of the clients that you might encounter in your field agency who can benefit from mindfulness component incorporated into your CBT work. So when you come back for Zoom class, we'll watch some additional videos and you will have a chance to practice some mindfulness skills. So thanks for watching. Have a great week, and I'll see you next week.